When we're dealing with somebody who's at the end of the disease, who's back at the level of being like a baby, who needs every single thing done for them, they can't feed themselves, they're totally incontinent, they can no longer sit up. We need to bring the spiritual in for them. We need to pray over them. We need to lay our hands on them and ask God for his comfort. We want God to be with them, and we want this person to be aware that God is with them. We might want to bring somebody like a parish nurse in from the community that they belong to, their church community, and come in and also minister in a spiritual way. But we as caregivers need to know that the spiritual basis that this person had maybe as a baby is still there. And that praying with the person, praying over them, singing to them, playing music that may have been part of their faith tradition, all of it's good. All of it is a way of reaching in to a brain that's no longer working as it once did. But the spirit is still there. And we want to feed that spirit no matter how the brain is working. We want to feed that spirit in the way that the brain can comprehend. And at the very end, the brain comprehends what a baby comprehends. And so we minister just as if we were ministering to an infant or a very young child. Spirituality is there no matter what the brain condition the brain is. And we need to be aware of that as caregivers. So in the hospital, we need to be, as nurses and doctors, bringing in people that are prayerful and praying over somebody with Alzheimer's. We certainly would want to involve the family in that prayer as well. If we know the person's religion, we may be able to get a rabbi to come in, or a priest, or somebody else who is a representative from that religious faith to come in and pray over this person who has this disease. Usually the family will be so grateful. We will never know whether the patient is grateful. We don't know that. We have to be sure that the prayer is not wasted, that at some level, just like we're sure when we pray over a baby, that the prayer is heard by God, and that at some level the baby hears that and understands it. The same is true for the person who's at the end stage of Alzheimer's. Prayer makes a difference. Prayer with and prayer for. And so we want to provide both. Prayer with that person, prayer for them, prayer for their family caregivers, and anybody else that touches that person. We want them to be giving the most loving care that they can. And when they do that, they're ministering in God's name.